Good day, my dear postgraduate students. Today, we shall deal with an important practical topic which can come as an ancillary exercise for us in the university exam. The PERLS Prussian blue stain. PERLS as such is the name of a person and there is no apostrophe as such. Now, you find that during the Franco-Prussian War, there was a uniform that was worn by the soldiers. And this invariably matches the stain and hence is called the Prussian blue stain. And that is supposed to be part of Berlin and so on and so forth. Later on, it became Germany. In 1867, Max PERLS was a German pathologist who introduced the PERLS Prussian. And his name itself is PERLS, P-E-R-L-S. Therefore, no apostrophe is there. So, a nice picture derived from the net. Principle. Whenever there is any exercise, we should know the principle. The sections treated with hydrochloric acid have the proteins denatured and they are bound to the hemochromatosis granules. After which the ferric 3+ ions are released. The ferric ions combine with potassium ferrocyanide to produce ferric ferrocyanide, which is an insoluble bright blue pigment, namely the Prussian blue. So this we will have to memorize. There is a denaturation of the proteins and it gets bound to the hemochromatosis granules. Ferric ions are being released and the ferric ions combine with potassium ferrocyanide to form ferric ferrocyanide. This will be very important and you shall be crystal clear in your answers. Also, this will tell us why we are doing something at the end of the stage. This was used to detect the iron in the tissues or even cells. Max PERLS, he was a German pathologist and this was his period, 43 to 81, not a very long age. He described the staining in 1867 and the Prussian blue is formed within the tissue. It is not an externally applied dye, an important point as such. Normally you find that Alcian blue, it is being applied from outside and the cells take it up. On the contrary, here it is not the application but the production rather within the tissue. The iron in the ferric stain and ferritin as well as the hemochromatosis take up this stain. This is a beautiful picture. Pertinently, I have chosen the painting with a Prussian blue color. And excellent credit to Margaret Calendar. I hope if we cannot buy such costly ones, let us at least recognize these people and kindly propagate it. Let her benefit from it. The uses. Non-heme ion in ferritin and hemochromatosis are stained by this method. Non-heme ion, which means the heme ion is not being stained. Hemochromatosis is not soluble in alkalis, but soluble in acids even after fixation. That is why we should be careful. When the tissue is being treated with acids, the hemochromatosis might get disrupted or even dissolved. So that has to be avoided. It is not soluble in alkalis. And It does not stain the iron that is bound to porphyrin, such as hemoglobin or myoglobin. These are all bound to porphyrin and they do not take up that color. Be very clear with your answers. It is not a very difficult stain at all. So it is a non-heme ion, not bound to porphyrin. Now look at this one. It is a section of the liver and I find that there are enormous fine crystals which are coalesced together to form large irregular masses of blue color, without which it might be difficult to make a definite diagnosis. To differentiate iron deficiency anemia from beta thalassemia. This is a routine day-to-day problem that we are facing, particularly if it is going to be a young child. Still in India, my first diagnosis will be iron deficiency anemia. But if you do suspect a beta thalassemia, then not the peripheral smear, but the bone marrow will have to be stained for iron stores, PERLS, Prussian blue. So if it is going to be increased 4 plus or 5 plus, then it indicates a thalassemia rather than an iron deficiency anemia. So the difference between the blood pictures, you people can go, it looks more like a sickle thal for me. And this is the grading of the bone marrow iron stores. You people will have to read up this grading. It is from Gale et al. And it is an authority that has been accepted worldwide. Therefore, from grade 0 to grade 6, I would like you people to kindly go through and memorize. No visible iron, whereas here there are large chunks of deposits of iron, both intra and extracellular. This is very important. You can use this particular table for answering a question on sideroblastic anemia or even an iron deficiency anemia. Thanks to University of Rochester Medical Center. What we are seeing here are dumbbell-shaped structures. Obviously, this should be the sputum. And maybe these are some macrophages which has engulfed. But then there are two structures which are possible. One is called a ferruginous body. A ferruginous body is just a structure of iron. Whereas when there is a combination with asbestos, it is called an asbestos body. And in order to confirm the diagnosis, we can do a PERLS Prussian blue. And you look at the blue color that is being taken up by the iron. Here again, I'm finding a tissue with stores like this. I should be very careful. From this, not much of an inference could be made out, except that it is strongly positive. This can be an eccentric arteriole in a spleen, or it can be even a venular structure. Whatever be it, I find that the tissue is stored with iron, which is positive for PERLS Prussian. And now, what are the applications? Always in my classes on the special stains, I give at least 10 to 12 applications. As a student, if you can answer 5, you are excellent. Let us take a look at the list. Hemosiderosis, hemochromatosis. Hemosiderosis is the deposition of iron in the lymphoreticular system, whereas hemochromatosis is in excess to it and it is deposition in the parenchymal organs such as the liver, the pancreas, the adrenal, or sometimes even the heart. So these two are important uses. I would like you people to kindly go back to my class on hemochromatosis, which is an important essay question for you. Iron stores in the bone marrow. I have already shown you the degree. Some pictures also shall come up. Iron deficiency anemia. Obviously, when there is not going to be any iron, and I'm seeing a hypochromic RBC, then it is probably iron deficiency anemia. I mentioned earlier to differentiate iron deficiency anemia from beta thalassemia. Ferruginous body in the sputum. Restrictive cardiomyopathy due to iron deposits. I shall show you a picture of it later. Let us continue with the applications. Congestive cardiac failure. It can either be a left heart failure or a right heart failure. In the case of a left heart failure, the alveolar spaces are ridden with hemocydin pigmentation, which are being engulfed by the macrophages, being called the heart failure cells, or the brown induration of the lung. In a case of a right heart failure or in cirrhosis, you find that there can be deposition of iron in the spleen, and these are called the Gandy gamna bodies, which can be demonstrated by means of PERLS Prussian. Haemochromatosis I have already mentioned. Strangely, there can even be a gastric ulcer secondary to iron overload. There is a deposition of iron. Normally, you find that there is a mucosal block theory. The excess of iron will not be accepted by your body. But in some cases, you find that there is continuous absorption leading to the various forms of hemochromatosis. And this incidentally is the Bantu tribe, where the people, they used to consume alcohol that are being brewed or cooked in iron utensils. Earlier, it was thought that it was the alcohol that was causing an increased absorption, but then it is because of these iron kettles that increased amount of iron was being constantly consumed. So much so it is said by Robbins that when the patient walks through the airport, he will be setting on the metal alarms into action. And it is also used to rule out hemozoin pigment. Hemozoin pigment, melanin pigment, they all have an overlap, but they will be negative for the Prussian blue stain. And in addition, the melanin can be stained by the Mason's compound. So these are the Gandy gamna bodies, wonderful pictures, and the reference is this due recognition to them. And look at this over here. There is a deposition. If you are very clever, these yellow arrows point out to some brown deposits, and these are bluish in color. In fact, these Gandy gamna bodies are supposed to be deposits of iron and calcium, and they are usually in the peri-eccentric region or adjacent to the eccentric arteriole. And when they are stained with the Prussian blue, they take up the color. As you are seeing over here, this again, this is not the spleen, but it is an adenomatous polyp. Here also I find that iron is getting deposited in the walls because of continuous uninterrupted absorption of iron. This incidentally is the spleen, which I can identify by means of the eccentric arteriole, and this is the splenic trabeculum. And I find that exterior to it. Usually the arteriole, it is called an eccentric arteriole because now it is not in the center. And I'm finding the deposits of iron and calcium. The iron takes up a blue color. Haemochromatosis. You are not convinced with my explanation earlier. Look at these sets of specimens. The liver, pancreas, and the adrenal. Thanks to WebPath. You find that all of them have a very deep, dusky brown color. And when stained with the Prussian blue, look at the enormosity of the iron that is being identified. Haemochromatosis. The materials and methods. The steps are not much, but you people will have to practice it. So there is a buffered neutral formalin for fixation. Usual paraffin sections at 5 microns. And the solution consists of hydrochloric acid and distilled water. So it is a 2% hydrochloric acid solution. 2 plus 98 forms 100. Then there is a 10% Triton X. Again, 10 ml of Triton, distilled water 90. When you add, you get 100. So it forms 10%. A few grains of thymol, it is a preservative. It prevents the growth of fungus. Another substance is potassium ferrocyanide. This is important. Ferrocyanide again in distilled water. 10% tritoniums. So what happens is the hydrochloric acid and the potassium ferrocyanide solution are there. And finally, you find that there can be a counter stain by means of nuclear fast red solution. So these are the staining materials that you people will have to remember. This may be corrected to 2 grams. The counter stain can be the nuclear fast red, and this is prepared by this method. 0.5% is the concentration. There are other methods for the demonstration of iron. One is called the Gomery's method. It was supposed to be very strong, but the PERLS method has been adapted and it has stood the test of time. There is another point also, out of interest I have marked it. After you cut a bone by means of a motorized cutter, the particulate of bone can be directly stained by the Prussian blue instead of having a section cut. So it is literally a gross specimen being stained with Prussian blue. We can have these points in mind. So the staining procedure will be like this. Deparaffinize, then the slides are placed in hydrochloric acid and potassium ferrocyanide. And you rinse with multiple changes of distilled water. The counter staining is with nuclear fast red. And rinse with 3 changes of distilled water, graded alcohols, and finally there is xylene clearing and mounting. Mounting, they recommend a synthetic resin, but in some places they do mount with DPX, but it is likely to fade. So the staining results will be the iron takes up a bright blue color, nuclei are red in color, cytoplasm is pink. There is another alternate method called the Culling's method for PERLS Prussian. You people can go through it. I can stain either the frozen section or the paraffin section or celloidal, and it is almost the same. Only thing, the timing can vary. And there is a heat that is being used. It is done at 60 degrees centigrade. There are several changes of distilled water and washing, and counter staining is by safranin or neutral. So the steps are very simple. It is only hydrochloric acid and potassium ferrocyanide. You wash, there is a counter stain, again you wash, you mount it. And you get this. This is from the Wikipedia. A beautiful one over here. Again, probably it is a trabeculae or it is a central vein, and then I find that there is a lot of this deposition over here, either the spleen or the mode of action and the staining is here. I mentioned it earlier. Again, it is the same. You people can just go through it. This is a very important step. I would like you people to kindly remember it. We have already mentioned it. The chemical reaction for the conversion of iron to Prussian blue is provided as follows. And this was by Drury and Wallington in 1980. So you find that ferric chloride plus potassium ferrocyanide. It gets converted to ferric ferrocyanide, and then the potassium chloride is being liberated. Ferric iron, potassium ferrocyanide, ferric ferrocyanide, or the Prussian blue is being formed. Sideroblastic anemia is another condition. So in this, there will be a dimorphic anemia, but I can see some particulates in the perinuclear region. Mainly the degenerating mitochondria and other things, they will be having the hemocytin pigmentation. And they are called the ring sideroblasts. And for confirmation, then electron microscopy can be done, or a PERLS Prussian blue, as in this case. It is possible. In cardiomyopathies, the heart develops a rusty brown color. There can be hypertrophy, and there can be golden brown granules also. Dear students, this is a very, very, very important slide. In H&E staining, there are only 2 colors, hematoxylin and eosin. Some cells are colorless, example fat. But in this case, there are a good number of substances which can take up a light, or a dark brown or even a brownish black color. As a result of which there can be a lot of confusion. Let us see what the differential diagnosis for the iron pigment can be. That is where the importance of PERLS Prussian blue comes in. One is melanin. It is usually deep brown or brownish black or black itself. A Mason's fontana can further aggregate the black nature of it or a Doppler reaction. Lipofuscin, the aging pigment, is usually a golden brown pigment. It is seen in the perinuclear region of the old cells. The stain for it is the small stain. Hemosiderin, we had seen earlier, can be stained with the PERLS Prussian blue as we are seeing. This helps us to differentiate it from the other substances. Bile, for example, in the liver itself, we can have both intrahepatic as well as sinusoidal bile deposits, which can be stained with the Fauchet stain. Hemozoin pigment is found in the malarial parasite intracellularly within the phagocytes. Formalin precipitate. Normally, you find that formalin can get precipitated and we will find it difficult. One way to identify it, if you use the fine adjustment, they will be in a different plane. But then, if you want to confirm, then a picric acid can be used. So these will be the histological differential diagnosis for the brown pigment. Coming to the counter stains. A half a dozen stains have been given over here. You can choose anything. Picrocerious red, fast green, 0.1% safranin, floxin, tartarizin, aqueous eosin. These are all counter stains which can be used. And the control for the pearl stain itself is the bone marrow. A normal bone marrow must be taken, not an aplastic marrow. This is a sketch of the haemochromatosis of the heart. There is an enlargement of the heart, but also a dilatation of the ventricle. Look at the golden brown color that is over here. It is quite pale. Now we will be having a doubt whether it is an amyloid or whether it is going to be hemosiderin or is it some fatty insinuation. But when you look at it microscopically, I am able to see the pale brown pigments in the perinuclear region of the cardiac myocytes. And when stained with Prussian blue, it takes up a bright blue color. These are the references. And I mentioned the others also along with the presentation. A slide showing the colon, wherein there is a continuous absorption of iron getting deposited in the submucosa or in the lamina propria. Let the blue sky meet the blue sea, and all is blue for a time. Monsi Barber. Look at the range of blue colors itself. This is different from this. And are you people aware that sometimes a metastatic squamous cell carcinoma, when you use the normal MGG or the GNSA or the Leishman stain, can take this kind of a color, and with this I will be able to identify the metastatic squamous cell carcinoma. Thank you for your patience.